How are leeches used in modern wound healing? Have you ever wondered how something as simple as a leech can play a role in modern medicine? Let's take a closer look at how these creatures are used in wound healing today. Leeches are primarily utilized to treat venous congestion. This condition happens when blood flow out of a wound or surgical site is blocked, leading to swelling and discoloration. If not addressed, this can result in tissue death, which is a serious concern in emergency and reconstructive situations. For instance, when fingers, ears, or skin flaps are reattached, proper blood drainage is vital. Leeches come into play here by drawing out excess blood. This action relieves pressure and helps prevent tissue damage. But the benefits do not stop there. When a leech detaches, the wound continues to bleed for a while. This prolonged bleeding is beneficial as it improves oxygen delivery and encourages the formation of new blood vessels, which aids in natural healing. Leeches secrete saliva that contains several helpful substances. These include anticoagulants, which prevent blood from clotting, and vasodilators, which widen blood vessels. They also have anti-inflammatory properties and can relieving pain. All these factors work together to support wound healing and reduce swelling. In emergency preparedness and first aid, leech therapy can be an important option when traditional methods to restore blood flow are not available. For example, in cases of crush injuries or amputations, leeches can be applied during the critical post-operative period. This helps maintain tissue viability until normal circulation returns. Applying leeches is fairly straightforward. Typically, 1 or 2 leeches are placed on the affected area for about 20 to 120 minutes. After they detach, the wound may bleed for up to 48 hours. While this is good for healing, it requires monitoring to manage blood loss and prevent infection. To reduce the risk of bacterial infections from leech bites, antibiotic prophylaxis is often given. Leech therapy is also showing promise in treating chronic wounds and ulcers. It can enhance blood and lymph flow, reduce inflammation, and promote tissue repair. However, it is important to consider the patient's condition and the type of wound before using leeches. Hygiene is also crucial to ensure safety and effectiveness. Understanding how leeches can be used in wound care expands treatment options, especially in resource-limited or field settings. This knowledge can be particularly useful when managing complex wounds with compromised blood flow. Proper training and protocols are essential for safe use, including managing post-leech bleeding and infection risks. Overall, leeches play a unique role in modern wound healing by relieving venous congestion, improving blood circulation, and delivering bioactive compounds that support tissue repair. This makes them a useful tool in emergency and reconstructive wound care.